Hi there. Good morning, everyone. My name is Lee Jacobson. I'm an event and program manager at the Seattle Metro Chamber, and I'm excited to welcome you to the 58th installment of our Executive Speaker Series. So the purpose of these events is to highlight the different industries that are vital to our region and our economy. As we progress through the phases of reopening, the series is looking specifically through the lens of economic recovery and how the industry has pivoted over the last year. So today, our great panel is going to discuss how our region's healthcare sector has weathered the COVID storm, what has changed for them, what of those changes are here to stay. They'll talk about equity in our community. It's going to be a great conversation. So before we get going, I do have a couple of logistical pieces for you. If you need help during the webinar, you can use the chat box and just send me a message and I'll do my best to troubleshoot with you. If you have a question for our panel, and we encourage you to ask questions, we're saving about 15 or 20 minutes at the end of the program for your questions. So if you have something for our panel, go ahead and share it in the Q&A box. If you share it there instead of in the chat, it's a lot easier for us to keep track of and we won't miss it. And lastly, just a note that we will be recording today's webinar. I will share it with you all in the post-event email that I'll send, and it will be put on the event page. So if you miss part of the discussion, you can always check back afterwards. So we wouldn't be here without the support of our sponsors. I want to thank our presenting sponsors, Advanced Professionals Insurance and Benefit Solutions and the Business Health Trust, and our event sponsors, Bank of America and Kaiser Permanente. I want to take a few minutes to welcome Mei-Ling Slaughter, who is here on behalf of Advanced Professionals and BHT. So if you'd like to turn on your video and share a few words with us.
Good morning. Thank you for joining us for today's Executive Speaker Series on a topic that is especially exciting to us at Advanced Professionals Insurance and Benefit Solutions. As the General Managing Agent for Business Health Trust, our company helps Seattle Chamber members get access to health insurance and other employee benefits that are designed specifically for small and growing businesses based in Washington State. Whether you have 2 employees or more than 100, Business Health Trust can help you create a benefits program that attracts talent and keeps your employees healthy and productive at a budget you can afford. We offer exclusive choices from major regional carriers, including today's event sponsor, Kaiser Permanente, and Business Health Trust offers employee benefits that go beyond health insurance, including access to a 401k and other HR services, and a great PPE program that welcomes new and renewing members with face masks, hand sanitizer, and more. Business Health Trust is your source for employee benefits and can easily be accessed online at businesshealthtrust.com. Thank you for your time, and please enjoy today's Executive Speaker Series on the healthcare industry.
Thank you so much. Thanks again to our sponsors. They allow us to host these events via webinar for free or low cost, so we really appreciate their support. So now we can go ahead and get started, and I will introduce our moderator, Kiva Pierce. Kiva is the Director of Large Group Account Management at Kaiser Permanente of Washington and has worked at the organization for 17 years. In this role, Kiva is responsible for the retention and growth of large commercial groups. When she's not working, you can find her hiking with her 2 boys or working in the garden. So with that, I am going to turn it over to you to lead our discussion today. Thank you.
Thanks, Lee. Hi, everyone. Thank you so much for investing your time with us today. I'm happy to be here with you all to moderate today's discussion on the road to recovery in healthcare. This past year has changed forever the healthcare landscape, not just in how we deliver care now, but how we will deliver it in the future. And now is the time for big ideas and new thinking, continuous innovation, and empathy. At Kaiser Permanente, our mission is to provide high quality, affordable healthcare services and to improve the health of our members and the communities we serve. With us today, we have an amazing panel of speakers to provide us with insight on how their organizations have managed through the pandemic and what might lie ahead for healthcare. So it is my pleasure to introduce the following. Dr. Gary Kaplan and Katul Patel with Virginia Mason Franciscan Health and Common Spirit Health. Dr. Kaplan is currently CEO, Virginia Mason Franciscan Health, and Senior Vice President of Common Health Spirit, and previously served as Chairman and CEO of the Virginia Mason Health System from 2000 to 2021. He is also a practicing internal medicine physician at Virginia Mason and is recognized as one of the most influential physician executives in healthcare. Next, we have Katul Patel, is the Division President of Pacific Northwest Common Spirit Health and Chief Executive Officer of Virginia Mason Franciscan Health. Mr. Patel has executive oversight and leadership over the Pacific Northwest Division of Common Spirit Health. The division consists of Virginia Mason Franciscan Health and 2 additional hospitals in Oregon State. Mr. Patel has responsibility of 13 acute care facilities and more than 300 sites of care, including primary and specialty care clinics and same-day surgery centers. Next, we have Tatiana Sadak, who's a PhD from the UW School of Nursing. Dr. Sadak is a certified psychiatric mental health nurse practitioner, associate professor of geriatric mental health, and a director of graduate education at the University of Washington School of Nursing. Her research and scholarship focuses on informing healthcare delivery for patients living with dementia and their care partners. And finally, we have Meredith Vaughn from NeighborCare Health. Ms. Vaughn is the Chief Operating Officer and Interim CEO of NeighborCare Health. With a master's degree in health administration from the University of Washington's executive program, Meredith served most recently in leadership roles at large healthcare delivery systems, such as Virginia Mason and Peace Health. Meredith believes that in order to provide the best care for patients, her responsibility is to develop team members' strengths and encourage their growth while facilitating operational improvements across the organization. So thank you all to our panelists for being with us here today to share your insights. To begin, I'd like to ask each of you to briefly describe your organization and how the pandemic has affected you. How have you pivoted? Dr. Kaplan and Katul, why don't you start?
Thank you. Thank you very much. It's great to be with everyone today at another one in the event in the Chamber Series. Our organization, as many of you know, is in many ways a new organization. Building on the legacies of 2 storied organizations, Franciscan Health, with some parts of which CHI Franciscan have been here for over 120 years, and Virginia Mason Health System, which has been around for over 100 years now. And so we came together January 1 to form Virginia Mason Franciscan Health. We're very excited about it. You heard a little bit already in your introductions about we are a large nonprofit integrated delivery system across the Pacific Northwest and part of Common Spirit Health, which is a large national system in 21 states with over 140 facilities. We're very excited about the future of this new organization, building on the legacies of the past. And I think Katul could maybe tell us in a little bit more granular detail who we are.
Gary, thanks very much. And first of all, I just want to thank you, Kiva, for hosting us today and just being a part of this great panel. Just to add a couple comments to some of Gary's introductory remarks. First of all, for us, I just think it's just staggering to see that Virginia Mason Franciscan Health was formed during the midst of our pandemic. And if we go back to the roots of both of our legacy organizations, you look at Virginia Mason Medical Center at the time, was created under the last major pandemic we've had, and our sisters came here, in the early parts of last century to create what was now before the 2 organizations came together, CHI Franciscan. So we've had a very storied journey over the last 100+ years. The organization has grown significantly. As Gary said, we've been a very strong presence in the South Sound and also in downtown Seattle, but we do have a very large presence up in the Kitsap Peninsula and continue to grow. Our goal in the last year or so as we brought these 2 organizations is to create the most impactful healthcare organization in the state, but really focusing on the needs of our patients and creating what we believe is to be the right value, if you will, for our patients as they seek healthcare all throughout the state of Washington.
Great, thanks. Tatiana, how about you? Would you describe your organization and how the pandemic has affected you and how you've pivoted?
Good morning. Thank you, Kiva, for hosting. I am very excited to give you kind of a brief summary of how School of Nursing adapted during pandemic. So University of Washington School of Nursing is one of the nation's leading nursing schools. And like all educational institutions, we were very quickly forced to pivot and to offer our entire curriculum virtually online. What we couldn't offer virtually was very important clinical experiences without which we can't prepare practicing clinicians. So we had to innovate and find new options. We used state-of-the-art virtual simulations, remote teaching techniques, and we very quickly mastered the art and science of telemedicine and trained our students to provide pandemic-related psychological first aid. One of the most important innovations and new partnerships that was developed in the beginning of pandemic was our collaboration with Public Health Seattle-King County COVID call center. All of our undergraduate students served at the call center. They received amazing clinical training experiences and really supported the state and our residents in understanding what to do when they had COVID-related concerns. In addition to preparing students and providing service, we were able to graduate an unprecedented number of new nurses who started out in leadership roles in public health because of this important experience. And lastly, pandemic really brought to light significant shortages in mental health for older adults. So right now we're developing a training program to prepare all our nurses to have expertise in taking care of people living with dementia, their families, and to have some expertise in older adult mental health.
Thank you. It's important work. Meredith, let's pivot to you. Give us
Good morning. Good morning, everyone, and thank you so much for having me. It's a pleasure to be with you today, and not only on behalf of NeighborCare, but really all community health centers who have been significantly impacted by this pandemic. So a little bit about NeighborCare Health. So we're the largest community health center in Seattle. We've been serving the Seattle area for about 52 years now, and we have approximately 30 sites that are within our 5 primary programs. And those programs are medical, dental, behavioral health, our school-based health centers, and then our homeless and housing services. We serve approximately 71,000 unique patients a year, and that equals about 300,000 visits per year. We see patients with close to 60 different languages, and our payer mix, as you may know, being a community health center, is predominantly Medicaid at about 52%, as more than half of our patient population is at or below 100% of the poverty level. So the pandemic has been significant for us, as you can imagine. And in the early days, we had to pivot incredibly quickly. We have so many sites that are so different in size and therefore have very different capabilities for accommodating the very quick needs around safety and social distancing requirements. So we really had to look at every single site in terms of how many people, including staff and patients, could be in a building at any one time. Quickly converted to about 80% of our patient care being phone visits and about 20% being in clinic. And with every patient request for a visit, we had to screen them over the phone to determine which was most appropriate, whether that was in person or over the phone. Additionally, we had to implement greeters at the front door, which I know many organizations, including Virginia Mason and UW, have had to do to check for temperature and symptoms upon entry. And then very quickly had to put up testing tents in the parking lots of 4 of our largest sites, and both provided sick visits in those tents, but also testing for COVID. And then implemented a mechanism for doing car visits for patients that arrived in their cars. And similar to Tatiana, our behavioral health needs skyrocketed very, very quickly, and I can speak to that later. But we immediately put behavioral health, social work, and eligibility visits exclusively remote. And then a huge impact to the organization as a final comment is that we had to put many of our staff on standby. And that means not working, either by choice due to health risks for themselves or their family members, or needing to scale down our operations and maintain financial viability, because we are a CHC and we have a very, very thin financial budget, so to speak. So I'll stop there, but that's kind of a brief overview of who we are and how we had to pivot.
Kiva, I realize Katul and I only answered part of your question. So
Sure.
very briefly, I think as Meredith's speaking, I see so many common themes about what we had to do in order to pivot and to adjust very quickly, standing up our command centers across our greater institution, understanding our workflows, redesigning care processes, standing up COVID isolation units, all the while being certain that we were caring for patients with routine health needs. And I think one of the great tragedies and challenges of the early days and continuing even to today are the people reluctant to feel and who are unable to and don't feel safe accessing healthcare services. We've seen many more completed myocardial infarctions, heart attacks, strokes that are completed, clinical conditions where we know that if we had the opportunity to intervene earlier, we could have really impacted the course of individual diseases. So the implications around our workforce, the revenue decrements that across the country, and this is very true for our organizations as well, 30 to 50% drops in revenue, which meant that we had to look at furloughing team members, looking at new ways of working. So many implications. And we needed to become more nimble. We always thought of ourselves as nimble organizations, and yet we really needed to be able to react in real time. And at Virginia Mason, our Virginia Mason production system served us very well because we had a common language and we had a deep understanding of our work processes. So just a few thoughts there, and I know Katul, you probably have more.
Yeah, and I think Kiva, just to remind everybody, our first case, inpatient case for COVID was on February 28th at Virginia Mason Medical Center of last year in Seattle. Their second case was at St. Anne Hospital in Burien. And so, over the last year, as Gary said, we've evolved and matured as not only a healthcare industry, but as an economic and certainly a community partner all throughout the entire I-5 corridor and up into the peninsula, just because we've had to. And as Gary said, we've heard more and more stories from our our paramedic community that have told us when they show up at people's doors, the patients are much sicker than what they used to see. And we are very focused, and you'll hear some about this when we go through our discussion this morning, is we're focused on making sure that our community knows that it is safe to come to a hospital or to see your physician or your care provider in an outpatient setting as well. We want to make sure that we're providing that level of comfort, because we don't want the pandemic, if you will, to overcome some of the social needs, some of the clinical needs that our patients in our community need for us now and in the future.
Yeah, that's a good point. I think we've experienced this same thing at Kaiser Permanente as well. And so I guess just to carry that forward, Katul, as we're looking ahead from here, what opportunities do you see for the healthcare sector to grow or change?
I believe that sometimes when we don't evolve organically, there's events, life events, there's industry events that make you and force you to move. And this is certainly one of those, Kiva. And I know you've seen this being at Kaiser, but just to give everybody a little bit of context, within Virginia Mason Franciscan Health, we were seeing less than 3% of our visits in a virtual capacity. And telehealth has been in the docket, if you will, for us for many years to expand, but we've just not been comfortable. Our physicians and providers have not been comfortable. Our patients have not been comfortable. But this pandemic has forced us to become a lot more comfortable. And I think in the future, we're going to see a lot more of that than we historically did in the past. I will tell you, I've been in my career over 25 years. We've also talked a lot about making sure our patients are getting the type of care and the best kind of care that they need outside of the hospital, as opposed to coming into the hospital. And I think this is going to drive us to do that in the future. Gary and I are talking a lot more about creating more sites of care out into the community, closer to home, away from the quote unquote acute care hospitals. It is something that we feel is going to be needed. We've got a very strong partnership with you and Kaiser, obviously, and Kaiser model is built on the outpatient side of the business, and we're going to be doing that for Virginia Mason Franciscan Health even more so now.
That's great. I think this question I would ask of you, Dr. Kaplan, what's the biggest challenge to the industry right now?
Oh, well, it's a big question, and because I think my colleagues on the panel would agree, we are an industry with numerous challenges. So as I think about that, I try to think at a macro level on this topic. It starts for me with a lack of urgency, frankly. I think we've got huge issues that are impacting the people we serve, impacting our communities, whether it's, and I know we'll get into this hopefully, whether it's disparities in care and health equity, whether it's the cost of care, the quality of care. And I've often reflected on this as a CEO now for over 21 years. We as leaders often want our team members to feel good. And in many ways, we protect them. And we can suck it up as the leaders. And I think the result is perhaps a lack of urgency that we could ourselves help to create. That we need to shine a bright light on the things that aren't working as well as they should be in our system. We need to shine a bright light on our defects and our errors and on patient safety issues, which some of you know has been near and dear to my heart for a long time. And so I think as leaders, we have to take advantage of this window in time to tell the truth, to shine a bright light. And as proud as I am of our profession and of our industry, not get in the way of generating that sense of urgency, because the status quo is a lot like gravity. People don't necessarily say, "Hey, I want to change," but we need to change. We need to pivot in our thinking. And one of the things we've learned over time is that we can actually envision what's possible. And I believe that the pathway to higher quality, safer care, better team member and patient experience can very well be the pathway to lower cost. And if we can do that, then we will have much more money as a community to invest in education and roads and the environment. And particularly, and I know this is very much on Meredith's mind, to the people who are underserved, to the people who really need care and need health, need to understand what they can do to live healthier, more meaningful and successful lives. So those are the things I kind of think about when you say, okay, what's our challenge? And I think we're up for it as a profession, as an industry, and I know we are as an organization.
I agree. I think we've seen all of our organizations rise to the challenge and through this past year. So speaking on equity and access, Meredith, I want to ask you, equity and access to opportunity for the BIPOC communities is a crucial piece of our recovery. How are you including this community, and how can this change the industry?
Yeah, and this is, gosh, I could speak for an hour on this, Kiva, so I have to try to contain myself here and try to be succinct, because the organization that I'm working for, as well as the other CHCs who I talk to, weekly, if not more often, about how we're all dealing with this right now, is front and center of mind, because these are the people that we serve. And so just by way of example, so currently BIPOC and Asian Pacific Islander community members make up almost 52% of NeighborCare's patient population. So these are our people, these are our communities, these are who we serve day in and day out. And they're, the violence that's occurring right now in these communities and has been is rocketing and just not only affecting our patients, but affecting our staff day in and day out. And we are spending so much time on this, from building up our own staff, but also reaching out to our patients. And so in terms of answering your question more directly, we've been partnering closely with our other community health center partners in vaccination efforts. And that's where we can really make some progress right now as we think more about the systemic racism that's going on, the violence, and how to be not only focused on their healthcare, but on what's going on in their communities that affects their whole well-being. And so that is a larger effort. But in terms of vaccination efforts, you know, our patients are very attached to us, and are very hesitant and reluctant to go elsewhere to get vaccines, to get care. And so what we've really been trying to do is direct outreach from our organization to our patients that are either BIPOC, Asian Pacific Islander, or other, transgender as an example, who are really being targeted right now, and making sure that they feel cared for around COVID vaccination, but also just in general, and what support they need from us. And that's true for our staff too, because our staff is also predominantly of color, and they also are reeling right now. So it's a very emotional topic for me right now, and it speaks to not only just the physical wellness and safety of our patients and our communities, but also the mental and emotional and behavioral health needs that are also skyrocketing right now.
Yeah, exactly. I do think it's an important topic, so I want to just make sure, I want to ask if any of the other panelists have any other things that they want to add about how they're working with these communities, or before I move, because I do think it is an important topic.
Eva, I think it's just, go ahead, Tatiana, please.
I just wanted to add that we are just founded and starting up first in the country Center for Anti-Racism in Nursing. And we're really hoping to kind of lead the way on how we defined what anti-racist healthcare, what does it mean to be an anti-racist healthcare provider? And this is a very important postulate for our curriculum development, for the culture at the university. And in fact, we just rolled out our brand new undergraduate nursing curriculum that's really built on a foundation of diversity, equity, and inclusion. So this is the way we're trying to start addressing a very systemic issue.
That's great. Go ahead, Katul.
Kiva, I just was going to add, you know, this has been really top of mind for Gary and I, and certainly Virginia Mason Franciscan Health, and it really goes into effect when we start talking about how we've rolled out a lot of our vaccination efforts. You know, we've actually opened up locations and partnerships with churches and communities that do have the poor and vulnerable. You know, we've had examples of sites that we've opened up and kept open slots, if you will, for those that truly at the highest need. And I think that during the midst of a pandemic, it just gives us an opportunity to take an issue that's so important like this and actually really focus on outcomes and results. And this has just been a way for us to unify as an industry, and certainly you know, as community leaders all throughout the state.
I agree. I think the work that I feel lucky to have been a part of some of these, like our COVID command centers, and the amount of work that I see that goes into this across all the organizations. I mean, it's just been really heartening to see how everybody's worked together to get access to everybody to get the vaccine. So sort of a little bit still on this topic, but Tatiana, I want to ask you, more and more companies are taking action to improve workforce mental health. What are some of the ways that employers can recognize mental health and wellness as an essential element of the overall workforce health? And I want to let you know, we're doing great on time, so don't feel like you need to do it in 2 minutes or less.
Thank you, Kiva. That's an excellent question that's difficult to answer in 2 minutes or less. Well, let's start maybe with healthcare organizations, right? Because we are all becoming very aware of what a toll the pandemic had on our healthcare workers, healthcare staff. And we're also becoming aware that the stigma of mental health is still existing even among healthcare providers, where we ourselves are maybe the last one to acknowledge that we are completely burned out and stressed and maybe can't do it anymore because we feel tremendous sense of responsibility. So many healthcare organizations actually been creating new positions of wellness officers and really taking a very system-wide approaches to developing infrastructure for improving mental health of healthcare providers and to really break in the stigma. There's been amazing papers published in JAMA, which is kind of higher ranking medical journal, that's interviewed healthcare providers asking, what do you need from your healthcare organizations? And what they say is not necessarily starting with resources, time off, what would you, that's all important. They say, we want to be heard, we want to be respected, we want to be celebrated, and we want to be seen. So, and then of course, all the infrastructure and resources come into play. So I think we could kind of take this model to all the other businesses, is having consistent check-ins with your employees, regardless of if this is a very large business that works at the level of a team check-in, or a very small business where you just check in to see how people are doing. Providing access to infrastructure that's necessary to support person is very important. We can't just provide psychological, first aid and, talk to people and empower them if they don't have a way to, support their children, if their spouse is ill, if they have family members that have tragedies. But having consistent communication, and I believe that right now it's our responsibility of every human being is to learn these basic principles of psychological first aid. How do you recognize signs of burnout in yourself? And how do you start addressing it? And how do you recognize those signs in your colleagues? And how do you talk about it? And there's a lot of resources. If it's of interest to you, I can send you lists of resources to help people do it. But I feel like this has to be grassroots movement. We just can't have few people at the top, a few webinars here and there. I think we all have to take responsibility for offering this support and starting with ourselves, so then we can be there for others.
Kiva, I would just add, particularly in speaking to the business community, I think in some ways, and I wish it were true, you could say you're talking to healthcare people, you're preaching to the choir about this issue. Unfortunately, we have the same issues. And in fact, many people would say burnout is endemic in healthcare today. And this was pre-pandemic. And so now you add on top the disruption that the pandemic has caused, we realize that our incomes for some people, our resources are fragile and tentative, and so it's really accelerated this across the country, around the world, frankly. So I think it's critically important, and I think one of the messages that I feel would resonate as well with the business community is that it's essential to our ability as businesses to continue to function. It's essential to productivity. It's essential to accomplishing our mission. And so whereas some might have used to say, well, it was maybe a nice thing to have, but not a must have, I think it's becoming an imperative in our business world, in every industry, that we address these issues for our workforce and ultimately for the people we serve.
And this is Meredith. I just want to weigh in and emphasize that, because sorry for interrupting. I think it's just a critical point right now. And I know that our workforce too is really struggling right now after a year and a half of just exhaustion. Having to deal with really, really sick patients, but also covering for other staff that had to go on standby or furlough because of their own personal vulnerabilities, and just the emotional toll the last year has taken. And that is something that we as NeighborCare are also focused on predominantly right now, which is on workforce wellness, because we have a lot of providers who are just burning out and either wanting to reduce FTE, take FMLA, take time off, and that therefore impacts the entire organization and specifically our patient care abilities. So it is a huge issue right now. And I just wanted to emphasize that no matter what organization we work for, no matter what population we work for right now, it is systemic in terms of healthcare system burnout.
And in the last piece, more for general population, we know that people who have contracted and recovered from COVID, many of them have much lingering mental health symptoms as PTSD, anxiety, and other conditions, exacerbation of other conditions. We now know that almost 50% of all healthcare providers endorse having clinically diagnosable anxiety and insomnia. So our resources are just too sparse to address all of this, and we need to be thinking very creatively and preparing people at all level of practice, to be addressing mental health issues. It can't just be a specialty anymore. It has to be everybody's business.
Yeah, and I think, and I'll throw this out to anyone who might want to answer this, but kind of with that, because of the access, maybe our organizations need to find new uses for technology during this time. So what have your organizations done to help kind of create more access or ability? Because we do know that it has been a problem. And do you see these continuing after the pandemic?
Maybe I'll just start there. I think
Sure.
I mentioned this a little bit earlier, but we were significantly low, if you will, in the number of telehealth visits that we used to have at Virginia Mason Franciscan Health. At the height of our first and second surges, last year, we were seeing over 20% of our patients on the ambulatory locations that were, for virtual visits. We've now seen over 425,000 visits at Virginia Mason Franciscan Health. I for one think that there is going to be a significant number, as I mentioned earlier, probably into the teens, even more so in the coming years for a variety of reasons. I think, as I said earlier, patients have become a lot more used to it. There's, it doesn't mean for every single type of visit you want to do from a virtual perspective, but there's a lot of follow-up visits. There's a lot of well visits, if you will, that you can provide telehealth capabilities and make it a lot more convenient for our patients. They've asked for that for my entire career, and I think this is the first step in doing that. Gary is a practicing physician. He can actually even talk a little bit about, what his patients are telling him about the movement for that. Gary, maybe I'll just ask you to do that.
Yeah, I mean, it's the use of technology. I mean, its time has come, and it's almost embarrassing. We were on a slow ramp up, and I think that's actually true for most of healthcare. And what we and others in our region were able to do within just a week or two, and set up hundreds of thousands of visits, critically important. And what's been interesting for me is, in some ways, it's been a real opportunity. As a primary care physician, I started practicing a long time ago, but it was after the age of home visits, and so I missed that opportunity, even though I knew I wanted to go into primary care because I wanted to have continuity relationships with patients and families. But now you can see your patient in their kitchen, and you can see their pet, and you can see a sink full of dirty dishes, which might tell you something about their coping skills. And so it actually is a unique opportunity. The other thing, though, that I think was very interesting was as we began to open up again, with the governor's initial proclamation, so much of healthcare was basically shut down if it was an emergency or urgent. And as we began to open up again, we predicted it would be about 50-50 telehealth and in-person visits. And interestingly, and I think it was a pent-up demand issue, 75% of visits, patients wanted to see their doctor. They wanted, that relationship. They wanted to come in, and I don't know if you guys experienced that at all, but I think it's going to level off, but I think it's here to stay. I think access is a long-standing problem, and we've got to use every lever we have. Technology and virtual care is one of those. Better skill task alignment and use of all professionals, using our pharmacists and our nurses, our advanced practitioners, social workers, embedding with primary care, new and different ways so that we can free up access and really get the patients to the right provider at the right time for the right issues. I think that's going to help us improve quality, definitely improve access, and I think it will lower costs in the long run.
So I agree. I just want to add one thing because it's very pertinent, I think, from a community health center perspective, which is I completely agree with what Dr. Kaplan just said, and that, as we have started to recover our community health center patients, when we give them the choice now that it's a bit safer for in-person versus phone, they too are wanting to re-engage in person with their providers because it's been a long time and they're very reliant on our, on their in-person interactions for many reasons with our providers, with one caveat, which has been fascinating. And Tatiana, I think you'll appreciate this and maybe, similar experience, but it's a community health center phenomenon to some degree. But, as I said earlier, in the peak of COVID, we did the majority of our care through telephonic. And that does not mean telehealth in the traditional sense, meaning we were not using video. We were using simply and only telephone visit care. And an exception was made for the community health centers during the duration of the public health emergency, which is still continuing, to allow full monetary reimbursements for phone visits without video, where historically that has only been allowed if video was utilized. And so that was an exception made during the course of COVID. What we found, not just Neighbor Care, but the other community health centers, especially in the area of behavioral health, but true in the height of the pandemic, is that our patients preferred phone over video. And that is for technological reasons, that is for comfort or cultural reasons. And so we found that phone or video was more successful for community health centers at large. What's really interesting, and something that I think we're going to have to build upon in the future around behavioral health in particular, was that historically we have about a 25 to 30% no-show rate for behavioral health visits. When phone visits began as a result of the pandemic, our no-show rate for behavioral health basically bottomed out. It was less than 5% and continues to be so because our patient populations feel so much more comfortable in the comfort of their own home getting their behavioral health needs met. And I think that is something where the future lies. I can only speak for community health center patients, but that telehealth/phone option and hopefully the reimbursement that will follow, regardless of the pandemic, would have a huge impact on the behavioral health needs of our patients. And then one final comment, I'll stop talking. But in addition to that, we have a huge population of opioid addicted patients. And what we also found, as some of the regulations were relaxed as a function of the pandemic, we were able to start even providing even low barrier care to our patients that needed opioid addiction treatment. And we're able to do that over the phone. And the ability to reach patients tripled over the last 6 months because we were able to reach them in a low barrier way and start them in treatment over the phone. And so I guess what I would say is there is so much opportunity there for not just quote telehealth, but phone care. And how do we sustain that? Because our patients are benefiting from it.
That's an excellent point, Meredith. And this kind of leads to what I was going to say is I also, in my clinical practice, I just see people with dementia, their family caregivers. And what was interesting, family caregivers can't wait to come in person, but family caregivers would say that it's so much easier for me to see their loved ones who live with dementia virtually. Because by the time you get them out, ready to my office, come back, the routine is so thrown off that it's very difficult to adjust. So there's give and take. But this brings up an issue of equity,
Yes.
right? We still have so many people that don't have internet access, that don't have smartphone, that don't even have most people have reliable phone service nowadays. So I'm absolutely with you. And there's a huge barrier to reimbursement is a huge barrier for providing this care. There's a booming body of research that's showing that some of the most effective mental health, especially for younger population, is provided via text. So not even a phone. So I think the science is building up and I think it's exciting. And I think we just need to partner up together to make sure that reimbursement really follows and doesn't serve as a barrier to providing very good mental health.
Yeah, those are it's such an important topic. And I think maybe one of the silver linings that has come from this, like what you're speaking of, Meredith and Tatiana, is that we're still being able to treat people and we're meeting them where they want to be met, which is just it's great if we can continue that momentum.
I'll just also mention
Yeah.
from an overall perspective in this past year, I have not in my career seen this kind of collaboration in terms of providers all throughout this entire community. We've Gary, being part of a large healthcare organization, we're part of Washington State Hospital Association, and there's a lot of our fellow CEOs that frankly I didn't have a strong relationship with, just because I just didn't know them. And over the last year, when needs happened, when there was questions that were occurring, and it wasn't just a hospital/physician community, it was community providers, much like we have on this panel here today, that are really working collaboratively together. And for me, it's so unique that I've not seen it in my career. And I just do hope that that continues on into our future, not just around technology and some of the other things that we've talked about. I just do hope that that level of collaboration goes into the future.
Yeah, very well said. I agree. So I do want to just give the audience a chance and let people know to send any questions to the chat if you have any. And the other question that I would have, this sort of just, I think maybe from a community health care center perspective, and I don't know, Tatiana, for you, and I know that Dr. Kaplan and Cantul will have an answer to this as well, but how can the business community engage and learn from your work and what you do?
So this is Meredith. I'll speak up, and I'll try to be brief because I know we're coming to the end of the hour here. You know, I thought a lot about this question, and you know, I have several responses. One is a couple things: help us support and engage. You know, we haven't talked much about our homeless populations, which, as you know, are at an all-time high in the city of Seattle. Really think about the support from a business perspective of supportive permanent housing and low-income housing, because that is really where we start being able to secure our homeless population in terms of their well-being, not just health, but mental health as well. You know, help us support and engage our marginalized communities of color, which we've talked about a lot today. You know, again, especially now because hate crimes and violence are at an all-time high, and our patient and communities are really stressed right now. And that also speaks to the structural racism. And that includes everyone, not just healthcare, but businesses and other community organizations alike. You know, funding and a unified message about the importance of all communities and equal access to healthcare. And that just means more than just, you know, talking about it and supporting it verbally, but really taking action. And if you will indulge me, I want to read you something really quickly that came across my desk as part of a community health center, Washington State Community Health Center discussion about this very thing. And I had to step away because I was joining this call, but it really stayed with me. And I'm going to say it quickly. So our healthcare community now must dispense with the practice of solely declarative advocacy and instead pledge to undertake specific data-driven and impactful actions. We view the current moment as a key opportunity for values alignment among organized medicine, business, academic scholars, physician activists, policymakers, and most importantly, the communities we collectively serve. The medical community and others must strive to make these changes on two main levels: internally, through reforms with organized medicine, medical education, healthcare delivery, and business delivery, and externally by advocating for change through local and federal governments. These efforts must begin with a shared understanding that practices that reinforce racism were likely easier to systematize than they will be to dismantle. So thank you for indulging me. I just wanted to share that because I think it has impact.
Absolutely. I think so too. Thank you for sharing. Tatiana, Dr. Kaplan, Cantul, any thoughts?
It is very well said. The only thing I can add is kind of, I'm on my soapbox. We need to destigmatize mental health needs.
Yeah.
You know, as just regular everyday needs that I would be concerned if my colleagues are not stressed, burned out, and have mental health needs right now in the middle of pandemic. And I think every small business, big business, any size business can work towards helping us achieve this common goal.
I would, you know, I appreciate Meredith reading what she read, and would emphasize that I believe systemic racism, I believe gun violence, and many other things that may not be usually thought of as health issues. I believe these are all public health issues. Mm-hmm. And that means it's going to take everybody. Public health issues are not just healthcare delivery system problems. They're societal problems that we've got to marshal all of our resources to address. I have some other thoughts on the business community that, but I don't really necessarily want to interject those while we're talking about these so pressing social issues. So wherever you want to take it, Kiva.
Sure. I mean, I think we could probably spend the rest of the time here talking about this topic. So why don't I let's just close it with talking about your thoughts on the business community. And then if anyone else wants to just leave us with some final thoughts, because we are nearing close to the end of the hour. So we'll give ourselves some time.
Well, I guess what I was going to say is, the business community is critically important. And I'm one of those rare birds, as some people know, that I had the privilege of chairing the chamber a few years ago. And that was a real education from this healthcare guy to have an opportunity to lead in the business community. It just so happened that the $15 minimum wage and a few other things happened during that year. But I think we have numerous opportunities as a business community. I mean, we took advantage of one of those with Virginia Mason and Amazon partnering with our mass vaccination clinics, because we realized they had expertise, they had logistical expertise, they had space, and we had the healthcare expertise, the access to the vaccines, those kinds of things. So coming together for common good, it resulted in 40,000 vaccinations in just in the past few weeks. So those are very specific kinds of things. But I also think we know that the business community is the major provider of health insurance to people across this country. And I believe that the business community has yet to realize its full potential in demanding value for their expense, for this line item expense that for many companies is the single greatest line item expense to do what they do. I think I want the business community to hold us in the delivery system accountable for creating value. And that means we should stop paying for inappropriate care, for wasteful care, for things that add no value. The Washington Health Alliance, which is very active in our community with the providers community, as well as the health insurance, the payer community, and the employer community, is helping us understand that in a more transparent fashion. And I think we need to champion the role of business in helping to drive a more equitable, higher quality, lower cost healthcare delivery system. So that's my little soapbox around what I hope we can see our business community take charge of here for us.
I think you said it earlier best, or maybe it was Katul, but the right care at the right time, at the right place. And if we can get our partners to demand that, I think we'll start seeing, we'll see the results. Okay, well, we are nearing the end of the hour. I just wanted to thank everybody for your engagement. I think we had some great questions. I mean, some great conversation here. I appreciate you all taking the time. As panelists, I know that you're very busy to be here with us today and to take your time. And then also just again, to call out everybody that is here in the audience. I think that we are definitely in an era of webinar fatigue. But I think that this was a really important topic for us to discuss, and it was just nice to be able to hear from all of you. I loved hearing all your perspectives, so it was great. Thank you so much.
Kiva, thank you.
Thank you, Kiva. Thanks, everybody.
Great. And Lee, I can kick it over to you, or just oh, there you go.
Back. Yeah, thank you again to the panel. Thank you, Kiva, for moderating. I really appreciate all of you taking the time today for this really important conversation. One last thank you also to our sponsors for this event: Advanced Professionals Insurance and Benefit Solutions, BHT, Bank of America, and Kaiser Permanente. Yeah, thank you. This recording will be posted on the event page later today if anyone wants to revisit or share with a colleague who couldn't make it. And hopefully I'll see you all back at an in-person event sometime this year. Thank you so much. Bye-bye.
Bye.